Musical chairs, right?
So there's no Dr. Stan?
I don't know who Dr. Stan is.
Dr. Stan, I forgot his last name. But he talked to me on the phone when my dad was here in the first week.
Oh.
Stanley and
I've heard
Rumshar.
Sure, I'll bet.
Yeah, that guy.
Yeah, no, he's rotated off, and Dr. Hodis has taken.
They change once a week, every Wednesday or Thursday.
So each doctor has their own opinion?
I don't know what you mean.
Well, I asked him about my dad.
Yeah.
And he was telling me, well, if it was my dad, I would just pull the thing out of his mouth and just let that nature take its course. So
Okay.
I didn't think he really cared that much about it.
Oh.
My dad's health.
What have they told you about the bigger picture of your dad's health so far?
He has a wound on his buttocks area, and it's something to do with his heart, but I can't understand what Stan was saying on the phone.
Okay.
Well, let me explain to you what's going on. I'm not one of his treating physicians. I'm part of the palliative care team. And I want to start by telling you what we do. We're called the palliative care team, and that's a fancy word for the comfort team. And we're basically a hospital-based team of a doctor, a nurse, a chaplain, and a social worker, who are consulted by the hospital doc to sit down and talk to families when big decisions are being made or there's some other issue that needs to be talked about. In your case, I think the doctors here are trying to get down to sort of brass tacks about where to go from here.
I talked to the lady today, and she says my dad be transferred to a nursing home or something.
I don't know.
That's what she said to me on the phone earlier today. I think so.
Yeah. More important than that, where he's going to be is how we're going to treat him and that sort of thing.
Yeah.
That's what everybody's looking for guidance from you about. I was kind of wondering what the doctors have told you so far, what you understand about what's going on.
I mean, the doctors told me their opinion and, what they would do if there was their dad.
Yeah, if you understand what's going on so you can help make decisions, because that's the best way. If you understand what's going on, you can...
Yeah, I'm trying to get a hold of my sister. She's in the same profession you are.
Okay, that would be a good idea, I think.
Yeah.
Is she hard to get a hold of?
Yeah.
She is? How come? Is she out of town or something?
I know she works in Texas, and I believe she's on vacation right now.
Okay. Well, she's a doc?
No, I got a thing from the internet right now, so I can show you. She's the director of this place right there.
I wouldn't be the one contacting her.
Well, I'm just showing you what kind of profession she does.
People who know.
Have you ever heard that place? No. She does research for a hospital.
Okay. Is this Eileen?
Yeah.
So she's a PhD.
Yeah, well, she's been more than that.
Well, that's a pretty big deal.
Yeah. Here, I'll show you the other one. She's
Do we have her contact information?
No, you don't. We haven't see right here. This is her deal right here. That's her Fresno deal.
Okay.
I haven't talked to her in like almost 10 years, and her and my dad didn't really get it off pretty good lately, so I'm just trying to get hold of her right now.
Do you think she'd want to be involved?
I have no idea. She would say yes or no.
Yeah. Okay.
My dad told her a long time ago she better learn how to use a typewriter so she can have a job she won't have like my mom. But they've been divorced since 1974, so it's a long time.
Is there any other family around, or is it just
no, it's just me.
It's just the two of you guys?
Yeah.
How many siblings do you have?
Just one sister.
Just one sister?
Yes.
Okay. And do you have any kids or anything like that?
No, I don't.
Okay. And did your dad have any brothers and sisters or anything like that?
Deceased.
Deceased, so
yeah.
Everybody's gone in the family?
Everybody's gone.
Okay. Do you know who the decision maker is for him, like officially?
Me?
You are? Is there paperwork somewhere? Or?
Yeah, somewhere at home.
You can find that if you helpful if you bring it in.
Okay. Just make it
I'm going through the paperwork with state so I can get this the thing reactivated for the what do you call that? For the the insurance you get from the state, the secondary insurance. Yeah, that's what that is. I had that blue card from the state, but it was expired.
Okay. Well, you gave a quick summary of what you thought was happening. It sounds like you didn't have a...
Well, I mean, I tried to write everything. I tried to write everything down. I got it right here.
Okay, good.
Wrote all this stuff down.
Okay, this will help. Okay.
And I try to keep all the paperwork the one I can get from Kaiser.
Okay. Very good.
Yeah. We originally was from Torrance, and then we came down here.
Well, let me tell you what's going on with him, because I think the hospital team here needs family involved in the decision making, because he's pretty sick.
Yeah, I understand that.
Know that. So he's got a terrible infection.
Okay.
Everybody's presuming that it came from the sore that's on his bottom. Nobody knows for sure, but that's the presumption.
That's what Dr. Stanley said.
Yeah. The bacteria get inside the wound, and then they make their way into the blood. And once they get into the blood, they tend to infect other things. In his case, the bacteria got into his blood and infected his heart valve.
Okay.
And the heart valves are obviously very important because they make your heart work as a pump. The heart's just a sophisticated pump. It's got one-way valves and it squeezes. And one valve on one side opens up, and the other one on the other side closes.
Like a piston?
Yeah. And with each squeeze, blood pushes one way, because the valve on one side closes and the valve on the other side opens with each squeeze. So the valve that closes, called the mitral valve, isn't closing. It's infected, and it's got a big bunch of bacteria on it that you can see.
It can't be repaired?
Well, probably not. And so his heart, because of that, isn't working well as a pump. We call that heart failure, because the heart's main job is being a pump. So it isn't doing that. So the blood isn't getting to the rest of his body very well. And the problem with that is that heart failure from a valve tends to get worse with time. It doesn't just sit there and stay stable. So
the blood has to go somewhere?
Yeah, the blood backs up rather than going out to your body. It backs up and tends to fill up in your lungs and your legs and tend to get swelling. So the doctors, there's two things going on. Number one, he's going to need 6 or 8 weeks of antibiotics in his veins to try to get rid of this infection. And number two, he needs special medicines to try to keep his heart working as well.
Yeah, well, that's what he's been doing before.
Right, but it's going to get worse probably with time. They had surgeons evaluate him to see if they thought they could repair this valve, and they don't think that they're going to be able to ever repair it. They're not 100% sure about that, but their strong feeling is they probably won't ever be able to repair it. And this is pretty nasty because it gives them a pretty poor prognosis. Now, he was already pretty demented, it sounds like. And I kind of wanted to get a feeling from you about that. But before I go on, I just wanted to say he's pretty...
When you say demented, what do you...
His ability to think is not as good as it.
Well, you got him tied down. You got him restrained, and then you took his glasses away, so he can't see you. Yeah. And then when he has his restraints on, probably gets flashbacks from World War II.
Okay. How was he before, though? How was he, like, months ago?
Before, he was okay. In November, he was going to the bathroom by himself, with the walker, and he was using the bed by himself.
Okay. Was he able to take care of his own needs?
Yeah, I mean, talking stuff, yeah.
And he was talking and recognizing family members and, okay.
I want to watch his TV every day, his Wheel of Fortune and his Jeopardy.
You live with him?
Yeah, he lives with me.
He lives with you. So he didn't need that much care.
No, the people from Kaiser came over, the home health care people came over and evaluated him, and they said he was okay. But then, that meter on the, where you take the blood, it was chopped to like 300, so I took him in.
And I think that was probably because of the infection, right?
I'm not a doctor.
Yeah.
I
mean,
came
that was
because,
at the same time.
Yeah, it was the same time.
Yeah, so probably because of the infection. So I guess the bottom line is this. The doctors are really worried about him, and they really think that he's probably not going to live through all this. That's the big
I mean, should get a week, a month, a year, or...
Nobody knows. Nobody knows.
I mean, my dad's pretty tough.
Yeah. That's true, and I understand that, but sometimes, it doesn't matter how tough he is. And I think in this case it doesn't matter. This is his heart. And I think it's just going to get weaker and weaker with time. So the doctors here kind of want to prepare you for that, number one. And then they want to ask you a very important question. There are a lot of patients in this situation when they know they have an illness that might take them. And in his case, I think it has a very large chance of taking his life. A lot of patients who know they have an illness that has a high chance of taking their life, they say things to us like, I don't want all that aggressive treatment. Leave me alone. Make me comfortable. If I'm going to die, I don't want to go through all this hospital stuff and all the poking and prodding and tests and antibiotics and surgeries and whatever. I'm going to die, leave me alone, make me comfortable. And I guess what they want to know is he one of those people? And the only way we can figure that out, because he can't really answer for us, is to...
No, ask him in German.
Do you think that'll
He
work?
must be talking off Deutsch.
Is
You
he
think that'll work?
fluent in German?
Yeah, he's fluent in German, and you got to take the restraints off.
Well, I don't think we can do
I
that.
mean, what first people downstairs did.
Yeah. But you think he'll be able to answer?
No, I mean, I could talk to him, you know, but...
Yeah, that's what we'd like you to do. Why don't you...
I already asked him when Bruce went that one night in Germany if he wanted to go to the cemetery or not, and he says no. Because he paid a lot of money for Kaiser all these years and he wants his money worth.
But that's not the right question.
I mean, that's, you know,
Yeah.
you have to be blunt about it. You know, that's why my dad was always be blunt about it.
You know, you can be blunt, but nobody wants to die. So if you ask him if you want to die, everybody's going to say no. But if you say that the doctors think you're dying, and do you want to go through a lot more stuff in the hospital or just go home and be made comfortable, that's a different question.
Yeah.
So...
I mean, it's not very comfortable if you keep tying him up like that.
Yeah.
You know, that reminds me when with Stalingrad with the German army military, he got caught with the Russians. He got tied up and he got his boots thrown away, and then you know got let go in the snow.
Is he a prisoner of war there?
Yeah, in Russia.
In Russia.
Yeah, for a little bit, and then you know let him go. See, in Germany, the philosophy was with Hitler, if you didn't have blonde hair and blue eyes, you went to the infantry, went to the bad part of the army where you're likely to get killed. So my dad had black hair and brown eyes, and he did, you know, wasn't your typical German person looking, so they sent him to Stalingrad. And, you know, they only give you enough fuel to get there to fight the war, and then, you know, as you know, that's was the turning point in World War II with them in that part of the country.
Wow.
So they took my dad's boots away, and they tied him up, and they sent him on his way in the snow, barefooted. Because, you know, that would get shot, so...
Crazy.
Well, what do you think he'd say to all this if he could have his full ability to think? What do you think he'd say to all this? Would he say, if I'm going to die anyway in a few months, just leave me alone, make me comfortable, or do you think...
No, he would keep fighting.
You feel that strongly?
Yeah, and that's what, I mean, it's been, you know, over the years, it's what Dad's been telling me.
Yeah. Well, what he's telling you is really different from what he would tell you now, because people can't really imagine themselves in this circumstance, and then once they're in this circumstance, they think very differently about it. So you've really got to try in your head to not sort of think about what he said before and think about what he would say now, because you know him. You know him well.
Well, I mean, we were asking
You're
about,
our best guess.
yeah, we were asking last night, when are we going home?
Right. But
And I go, oh, that's up to the doctors. My hands are tied.
But that's a different question from what I'm asking. Everybody wants to go home when they're in the hospital, and nobody wants to die. Those are two different
Nobody wants their hand over their mouth and not to breathe, right? Everyone wants to survive.
But you've got to ask the right question. And remember, the right question, and I wish you'd talk to him about it, the right question is, under these circumstances where the doctors think you're going to die anyway, what should we do? Should we take you home and make you comfortable, or keep plugging away in the hospital? That's the kind of question we'd like an answer to. And,
The sort of question is, where would he want to die?
Yeah.
If he knows his time is coming, would he want to be here with all these tubes and bells and restraints?
Yeah.
I can ask him, man, but, you know, he was telling me they should have young doctors in here that just got out of school, and they, you know, they're very go-getters, not an old doctor like Stanley that's been here forever. You know, that's my dad's opinion.
Has he ever told you when it's his time what he wants?
Well, I mean, my grandparents are buried in Chatsworth. You know, he has a little plot there. You know, he's going there. He went there every Saturday when he was little kids. We went there to visit the graves all the time. You know, he took care of his mother when she was in a nursing home and stuff. And
What did he think about his mother being in the nursing home?
he didn't like it because it was in Inglewood in 1978 and 1980. And it's not black people, but it's a bunch of minorities there running the hospital, and it was pretty bad in there. And you know, they told my dad, you know, if you don't like the way it is in here, you can change it yourself. So my dad went through every day after work and did it, you know, changed her. But my parents were divorced by then.
Do you think he's suffering
From what?
from being here and being sick?
Well, I'm sure he is. Nobody wants to be sick.
Right. Because what people do generally when they're able to make decisions for themselves is when the suffering gets bad enough, they say, I don't want this anymore. Stop doing all this stuff to me. And what I'm worried about, the more I read his chart, the more I realize that I think he's going to suffer a lot. I don't think he's going to it's going to be comfortable for him. Because when your heart's failing, you get more and more short of breath typically over time, and that's an uncomfortable thing. And that's kind of why everybody wants to have this conversation with you. As doctors, every time we walk into his room, we see somebody who's dying on us, and we don't think he's going to do well, and we really want to make that clear. If you were awake and alert, we could make it clear to him and say, what do you want us to do? But since he's not...
I mean, how did he get downstairs? He was downstairs last week, and now he's upstairs again, right?
Yeah.
And so doesn't downstairs mean you're more worse off than when you're upstairs, or it doesn't matter?
Yeah, I'm not talking about how he's done in the last few days.
Okay.
I'm talking about how he's going to do over...
Oh, in the next same period.
Yeah. That's very different. We can make him temporarily better. There's no doubt. But I think the big picture is that he's going to get worse and worse and worse. And that's something, I just want to prepare you for that,
Okay.
so that you can start thinking about that and start thinking about what he would want.
Is he ever likely to go back to what he was doing before?
I can say almost certainly not. He's going to have lots of problems with functioning. His heart's not working very well at all.
Well, is there any way you can give me a printout like I had before, like this, for my dad? Like this, where, like in transfer orders, that gives you a rough summary of what's going on with my dad,
I can't, but the doctors managing him here could do that.
and then I can email it to my sister.
Yeah. Why don't you have your sister contact the doctors here? I think that would be great. The more involved, the better.
I know my sister. She wants to know what's going on, and she wants answers right away, and so she evaluate everything. She doesn't want to call somebody. She wants to read on the paper what's going on.
Get a phone number. We'll call her and send her anything she wants. I think that's probably the best thing. Have you talked to her at all about it?
No. I haven't seen her talk in 10 years, but when I just want to make sure when I talk to her, I get all my, things. Last conversation I had with my sister was back in 1999, and she was working, doing her stuff,
Yeah.
and she's a very thorough person. And if you get down to her honest, she don't want to talk to you no more.
Okay.
She's very educated,
Sure.
very smart.
Do you think if your dad, because you were describing your dad as he's watching Jeopardy and Wheel of Fortune and all that,
Yeah.
do you think if he knew he'd never get back to home to do that, his quality of life, he's going to be bedbound for the rest of his life, in a nursing home maybe, do you think what would he tell you? Would he say?
I mean, just long as he is, he's got I don't know. I would have to talk to
See,
him.
that's the question. If he could never go home and be back in his house doing the things he loved, what would he tell you? What would he say?
I mean, the things he loved was just food and,
Exactly.
watch TV, and, that's about it.
Yeah, they're not sure.
He really didn't have a passion about, anything special. Every time I take him to Kaiser for his appointments, he always makes sure, he goes, make sure we go home, make sure we go home. I don't want to stay here. I want to go home. He doesn't like,
Doesn't like doctors.
No.
He's old.
He liked the doctors until they told him he had dementia. And that's when his turning point with Kaiser. That's the problems he started,
That
Kaiser.
upset him.
That upset him big time. Because he told him, I can find my car outside, so I don't got a problem. And then when he couldn't find his car, the doctor gave him a ride home, and they called me from Torrance and said, you need to get to Dad's car. So after that, it was down point. And then when he had that, it was back in 2012, something happened at his condo, and the neighbors called the fire department, and they broke down the door, and they took him to UCI Harbor Center instead of Kaiser, under John Doe, because they didn't bring his identification with him. And he was lost like 3 or 5 days, and when I finally found where he was at, I showed him the Kaiser card, and the lady right away got transferred to the other hospital.
To South Bay.
South Bay, right there. So after that, it wasn't too long with Kaiser after that. But,
When did that happen?
in 2012, 2013.
Been through a lot.
Yeah, I mean, and so that, that's what happened with that. But he said he paid Kaiser a lot of money, a lot of years, the insurance-wise, and he wants to get his money worth.
I guess I'm hearing the doctor say this might be his time, though. Everyone has a time to pass.
Well, I understand that. He can't live forever.
So the question then is, how will that look? And unfortunately, you have that tough job of having to interpret, what that might look like for him. Because he really can't answer for himself now.
Okay, so
Yeah.
are you guys pressuring me and
No,
dying
we
now?
just want you to know the situation.
Okay.
Well, and the hard part right now is,
I mean, I heard Stan already told me the situation.
He did. Okay.
Yeah, he goes, as my dad, I was the next to his course and just pull out that feeding tube. So.
because that's the hard part right now.
I mean, that was his, that's an easy way out for him.
The doctors don't think he can eat on his own anymore.
Because when he eats, it goes down one side and he gets right there. I don't know if he forgets to swallow or what it is. I'm not sure. I'm not a doctor.
It's a normal part of his dementia.
Yeah.
They can't continue eating on their own without it being a risk of choking.
Yeah.
And so,
That's where the problem is.
and even if he could eat, they don't think he could eat enough to to keep himself strong and healthy. So that's why the tube's in his
Yeah.
mouth. And
He likes to eat oatmeal a lot.
he tries to pull those tubes out, and that's why
He gets
they had
mad.
to restrain him, because if he pulls the tube out, then we can't feed him.
Yeah.
The doctors don't.
If you try to feed him by hand, then he'll start choking, right?
Right.
I'm going to point something out that I think will help you when you're thinking about these things. And that is that dementia is really, it's fatal. It progresses, and you die of it eventually.
Didn't you guys take the MRI pictures? And when it has, I think it says right here when we see the neurologist, what'd she say? Yeah, it says right here, it said benign of brain and dementia right here.
Say what?
Right here.
Meningioma of brain and dementia.
So that's what you're talking about?
Yeah, the dementia part.
Is it? I thought it was cancer. Benign was cancer, but it's not, is it?
No, you can die of you die of dementia. A lot of elderly patients die of dementia. And
Does the brain tell the body to quit breathing, or?
yeah, it tells it to stop eating, to stop breathing, to stop walking, to stop thinking, and over time, and you die from that. And I guess the reason that's important is because it's kind of like having a cancer when you get dementia.
So the Alzheimer's and dementia not the same thing?
Alzheimer's is a type of dementia.
Okay.
Dementia is just a word for, it's a fancy word for losing your ability to make logical connections and to think and memory. So dementia is the same as, in this case, it's Alzheimer's dementia, the type of dementia. In Alzheimer's dementia, you have a 5-year prognosis. That means your chance of living 5 years, you have a chance, you live about 5 years on average when you get a diagnosis of Alzheimer's disease. And that's important because it's sort of like having a cancer. Everybody thinks differently. Say you had lung cancer and you're making medical decisions. Well, that's important because if you have something that's going to take your life anyway, then you're usually less aggressive about the medical issues as they come up. And the problem with him is now he's got dementia, which he's going to die from eventually. Now on top of that, he's got a heart problem, which is going to make his quality of life pretty poor.
You can't fix that because he's too old, right?
Probably.
Or he can't survive the surgery.
Right. So on top of having dementia that's progressing and is going to make his life unpleasant, he now has a heart problem that's going to make his life very unpleasant, with lots of hospital stays, and it's going to be very difficult. And the reason we bring this up is because I have a lot of patients who are not demented who have the illness he has, who would want to opt out. If we said you're going to die from your heart, they'd say, okay, next time I get sick, just leave me alone and make me comfortable. And we just want to know that that isn't him. Is he the kind of person that look us in the eye and say, I'm dying from 2 things, leave me alone next time I get sick?
No, he'd probably tell you to get you another doctor, a younger one. And that's what he would say.
Do you think that's because he wouldn't want to understand what's going on?
No, that's because he thinks, I don't know, he thinks that people are smart, He thinks younger doctors are better because we just got out of the university.
He has a younger doctor now?
No, he said the younger doctor would be better in the university than an older doctor. Because the older doctor just has experience. He just walks around and does his thing for many years. The younger doctor is more go-getter. He has challenges and he wants to fix things. If somebody's sick, he wants to see what he can do to get it going again. Because, but I'm just,
He does have a younger doctor now. Dr. Hodes is a young woman. She is, I would describe her as a go-getter. And she's saying the same thing that Dr. Irmshar was saying, that she would recommend continued feeding because he's not really interested in eating anymore on his own. And they have to time down to get him to accept the treatment that they're providing. She thinks he doesn't really want it.
As your dementia progresses, you typically stop eating, and that usually means that's the beginning of the dying process.
well, I mean, he's looking at everybody in this big blur because, like, if he went to get her glasses off, would you like that?
No,
So, I mean, he does glasses, and then she has those glasses back on him.
What you do in a situation like this is you try to fix all the little problems as much as you can, like the vision problems. You try to take restraints off as you can.
Well, I mean, I brought the glasses over. I mean, how hard is that to put the glasses on a person?
Yeah, I have no doubt that would be nice for him to have his glasses.
He'd probably calm down a lot.
But I don't think it affects the big picture.
Oh, I know, but I mean, short picture, he'd calm down a lot.
Right. Well, what do you tell the nurses that?
I mean, I have, but every time I come here, it breaks off. I just don't understand. I don't understand the way it works in the hospital. I thought if a person's sick, they would have like a big logbook and says what's wrong with the person, and everybody would have access to the person's medical records.
If you have issues like that, you should talk to the nurse, and if that doesn't work, talk to the supervising nurse.
No, I mean, I'm just wondering because, like, at my work, if there's a pump breaks, we go there and make sure they all touch the pump, and it's all there and right there. If a person breaks, I thought maybe the hospital would have, like a program with all the, past illnesses.
I'm not one of the nurses, so I don't know, but you should ask.
When I brought my dad to the emergency room, I had to show the doctors all this because they didn't have it on their record.
Good. That's useful.
I don't get that. They just had general things that was wrong with them in the past. And a detailed picture.
I'm not quite sure why. Do you have questions about all this stuff?
No.
You said, are you guys pressuring me to not be aggressive with him? I don't want you to feel that way. What I would pressure you, though, is...
But it sounds like, it's like I go to work and it's like a meeting with all my big bosses about something that happened.
No, there's only one thing I feel comfortable pressuring you about, and that's trying to make you understand what's going on, and trying to see it from his perspective. When our relatives are sick, we tend to see it from our perspective, like how this affects me. Everybody does that, it's natural. I think we need to all try to concentrate real hard on what he would want for him, and that's why we wanted to...
Well, my dad grew up in a different culture.
Yeah,
a different whole episode. He's raised differently.
Sure. So that's why we need to ask people who know him what he would want. We can't just presume what he wants.
And right now we can't respect authority and do what you're supposed to do. Right.
Any questions about the medical care issues?
A couple of times when I came here, he had that bed, the one that has the air in it, was deflated, and they're trying to get somebody to fix it.
Okay.
A couple of times, happened a couple of times.
And
then I asked that one.
If you have these things, I would try to be around a lot.
Well, I don't want. I know, but I really don't want to. How you say this? I don't want to be. I don't want to be. I'm sorry. I don't want to be complaining about Kaiser's treatment with my dad. I don't want to complain.
It's just a different nurse every day.
I don't want to complain
every day. I don't think anybody takes it as Kaiser. I think it's helpful for you to be there and to try to point out issues that are helpful. Nobody's going to be bothered by that. So, I suggest be around as much as possible. Try really hard to understand the medical issues because they're complicated. And I think sometime in the near future we're going to have to deal with the fact that he's dying and we don't know what to do. We don't know if he wants us to let him go comfortably or if he wants us to be real aggressive with him and put him through lots of testing procedures.
Did I talk to one of these ladies earlier on the phone today?
Maybe it was Adita.
Adita. So
she's a case manager.
That wasn't you, right?
No, it wasn't me. The case manager, she's the one who would decide where he goes.
Yeah, because she told me that he might be transferred out today.
Yeah.
And then when I called her, like last week, and they're so he's doing fine. And so and then the other doctor calls me back and tells me something different. So I guess it's always best to come in person to find out.
Yeah, and it's best to talk to the doctor. When the nurse says he's doing fine, that just means he hasn't had any problems today. Doesn't mean that the big picture is good. It's a totally different thing.
Yeah.
So you really got to talk to the doctors regularly. I really suggest you talk to the doctors almost every day right now because there's a lot going on, and I think it would be helpful for you and for the doctors to have some guidance from you about what you think your dad would want. Because we're kind of desperate for guidance. We really want to know because honestly, I'll tell you what's in the head of a lot of doctors as they walk into his room. They think this man's dying.
It's hopeless, and the next person needs to come to use the room, right? Is that what you're saying?
No. We think this man's dying, and we want to make sure he's comfortable. That's what we're thinking. And
we want to make sure we're treating him the way he'd want to be treated.
Yeah. Every doctor's sworn duty is to him. My duty is not to you, to anybody else, but to him. And making sure that his wishes are respected is what we are all about. And to get to that, we want to talk to you about it. That's the only reason.
Well, my dad picked Kaiser because he likes the hospital and stuff, compared to if you ever been to where my dad used to live in Torrance, you go to Harvard UCLA Medical Center, the big hospital there, it's like, go through these armed guards, you get in there, there's people yelling and stuff, and then, everything's all cluttered in there, and then when you go to someone down the street in South Bay, it's all nice and calm.
Well, I think he's getting fine medical care. I think the main issue is now to make the big decisions about the big picture. The details are taken care of themselves. It's the big picture that really needs to be decided.
Do you think your dad trusted Kaiser enough that he would trust the Kaiser doctors to decide?
No, because one time he said he had an operation, it was back in 2005 or 2006. He said that after he had this kind of operation down here, he had to pee more, and he hated that. I mean, he just had it, And then he had other Kaiser doctors that told me I had dementia, and that really pissed him off.
Why did that bother him? Because he does.
Because he likes to be in control. You know? What can you do?
He probably found himself forgetting and...
I mean, that really
being
bothered him,
aware.
and he sent him to Stalingrad, you know, with no appeal to get back.
So he wasn't mad at the doctors, he was just mad that he had dementia.
You know, he was just mad that, you know, that they came, you can understand why they say such a thing.
Oh, okay.
And, you know, every time I brought it up, you know, he'd get mad. So I didn't bring it up with him.
Are you able to have conversations with him in German?
Yeah.
And he's able to answer questions? Because
Yeah.
I'm told he's not doing well answering questions.
Yeah, ask your questions. You gotta get the, you know, when you have restraints on a person and they can't see you, they're not going to give you honest answers. I mean, if you put your glasses on so you can focus and see what you look like.
We have a lot of people on restraints who can't see and they give honest answers.
I mean, you wear glasses, but you like it when you take off your glasses and you're talking to them, you can't see what you're doing.
Yeah, but when you're in the hospital, you want to give the right answers to questions so that you can get good care. So
Yeah.
people give straight answers even if they don't have their glasses on.
You know, since as you mentioned, sometimes my dad just goes with the flow. He just says, okay,
Yeah.
okay, okay.
So what do you think we ought to do with him?
And that's a big decision.
It is. I kind of think he's making it for us. I think he's already, dying. And I think it's just a matter of time, honestly. So we just have to decide what that's going to look like, to be honest, I think. I want you mentally prepared for that. That's why
I'm prepared for that. I mean, you're supposed to make a person comfortable before they die, aren't you?
Yeah.
Well, listen to this. If we don't have permission from the family to do that, it's hard. At some point, the family has to say it's time for what we call comfort care, where we stop doing aggressive things, we stop treating things as they come up, and we start to concentrate on comfort. And that's important for you to understand. So, no, we can't just give somebody comfort care unless the family allows that. And what that means is, if he starts to get short of breath, we don't have to poke him with needles.
You're not going to break his ribs with CPR. That's what
Exactly. Instead, we're going to do things that make him comfortable. We have to.
Or run the code. Is that what you guys? That's what you're telling us.
Yes. We have to have permission to not do things. Otherwise, we have to do everything. And that's why we want close.
Have you guys ran the code yet on him or anything?
They haven't had to think that. I think they're worried that
But
might happen.
But in the near future, he's going to be looking at lots of tests and lots of poking and lots of prodding and lots of needles and lots of catheters and lots of things that are uncomfortable. And I think he's going to suffer. And at some point, when somebody's dying, you tend to change over to stressing just comfort. And we need family's permission to do that. And that's what I want you to do.
I need to talk to one of my other family members that are older.
Yeah.
I ain't older, but more his age.
Yeah.
And,
It's a good idea. Who have you got around that you can talk to?
I have to go look around my Facebook for some relatives and sure me to get hold of.
So what it would look like, Ralph, is what the doctor's saying, is they would take the restraints off your dad, they would pull the feeding tube out, they would take all the needles out of your dad and let him be comfortable. If he wanted
And then it expire in 2 hours or expire in 2 days?
Probably not. And let him eat what he wanted to eat. And let him eat what he wanted to eat and do what he wanted to do. If he had a good day, he could eat what he wanted. If he didn't have a good day and he didn't want to eat, no one would force him to eat. No one would put tubes down his nose. And they would just let him be comfortable.
That's really what his doctor is recommending right now, because she doesn't think she can make it better.
And if he was short of breath, we give him medicine so he wouldn't be short of breath. If his heart stopped, we wouldn't push on his heart. We wouldn't push on his chest and break his ribs. We would let him be
Well, that's what the
comfortable.
lady said, or Stan said.
There's a statistic I want to share with you, and it's a really good one. A lot of medical statistics I don't trust very much, but this one I trust a lot. It was done in the 1970s. They took thousands of patients, and they studied them before and after they had their heart and lung stopped, before the whole code blue thing. And they found that no matter where you are or how old you were, your chance of surviving if your heart and lung stopped was very tiny, of the order of less than 5%. So 5 out of 100 patients survive if their heart and lung stop. And if you're sick, and you have many other medical illnesses, and he has a very bad heart.
Oh, I know, he's got a lot of stuff. He's got a whole list of stuff
I
here.
know, and his chance is even smaller. So I guess the way I put it to you is if his heart and lung stuff, his body's saying it's had enough, and it's time. And the idea of shocking his heart and doing CPR and all of that just doesn't seem right, and most patients don't want that. But to not do that, we have to have permission in advance. We have to have you say, it's okay, doctor. We can put an order on the chart that says, if he's dying, don't do all that stuff. We call that DNR, or do not resuscitate. It doesn't mean we stop taking care of him. It doesn't mean we stop doing anything. We still do everything.
Or when he gets so that DNR means so when he starts to die, so, okay, let him go.
No, it means that his heart and lungs stop. If he's starting suddenly on us, we don't do CPR and shock his heart. So if his heart just stops on us, then we don't do
Really
all that
means if he dies,
If
we
he
don't
dies,
try to bring him back.
we leave him alone, basically. And that's something that I think it would be humane, it would be nice to put on the chart at some point in the near future, just so that if he starts to die on us, we don't have to put him through all that indignity and suffering. And I urge you to think about that. I think it would be a good idea. We could write, do not resuscitate on the chart, and it takes a lot of the doctor's anxiety away about making him suffer at the end of his life. It doesn't.
I don't think the doctors have any sign about that.
Oh, that's
I don't
what they're all
think
about.
I don't think so. The way I talked to Stan on the phone, I don't, he takes care of that.
Oh, I doubt
You know, and that's the way it sounded to me on the phone.
Yeah, I think you got the wrong impression. I think the doctor's biggest anxiety with him is worrying that he's going to suffer. I think that's motivating much of what they do, because their job is to try and do what's right for each particular patient. And even if it's just out of pride for their job, they want to do what's right for that patient. But most of them are very personally involved and feel very strongly about not having their patients suffer. So I think you have the wrong impression of
Yeah, that's why they're also worried about the tubes right now, because to keep the tube in his nose, they have to tie his hands down so he doesn't pull it out. And then they tried to suction him to get the stuff out of his lungs, and he wouldn't let them. He would just bit down on the tube so hard that they couldn't get it in to get the stuff out. So he's
And when
letting
you
them
guys do
know.
this process every day?
They try all the time. Every time he's coughing and he can't get the stuff up, they try to help him with the suction machine, and he won't let them. He doesn't like it. He doesn't want it. So he bites down and won't let them into his mouth. So they're worried that.
Yeah, I wish I was here when it was happening so I could tell them in German. They're just trying to help you.
Is there a way you could take a day off and spend the day with him? Maybe, or maybe Saturday or Sunday, spend the day with him?
I could do that.
That would be
I
probably
think it's a
good.
good idea. It can be good for him and good for you. You can see what's going on. I think that would be really good.
And then you
But I don't want to get in, I don't want to get involved with your hospital affairs. You know, if I see something wrong and I start opening my mouth, I really don't want to criticize your work or anything like that.
Well, but you're a big boy. You
I
can
know.
decide not to do that.
Yeah, I know. I just observe.
Yeah.
Well, then you could help by speaking to him in German when they are trying to do something and see if he'll accept it. Because maybe he just doesn't want it, and maybe that he doesn't understand, and we don't know.
I just think it's a big blur. He can't see you right and what you're doing to him.
Is German his first language?
Yeah.
Spoke as a
So
child.
he speaks English?
Yeah. He was in Germany. He became an American citizen here. He worked at aerospace a lot of years.
Go back to his first language.
This is some good advice, and I really would ask that you and all of us too. Doctors are good at it. We're used to it, but put out all of our issues aside. So when you're thinking about being frustrated about the details of what's going on in the room, it really pays when your relatives are sick. Put all that stuff aside. Put it on the back burner, and think about doing whatever you can do to make him as well and comfortable as possible. I think that's really important. And it's hard to do. We have to push our personalities aside and kind of go with the flow. But this is what doctors do all day. We try to push our personalities aside and try to take care of patients, and we try to put them first. So I ask that you try to get over the details of what's going on in the room. I'm sure you can complain about something if you think it's important, but if it's the detail that you don't think is important, push it aside. It'll get fixed on its own eventually.
So you don't think that wearing glasses and seeing correctly is not a complaint?
It's for you to decide what's important. I'm not saying that's not important.
You'll know when you put the glasses on and you spend the day with them and you ask Dad, what's going on.
When he was at home, he always wanted his glasses. He was sure they were right when he went to bed. He would make sure they were right there, so when he woke up, he has glasses so he can see.
I was commenting on this because you had said that you may not want to be around for a whole day because you might get frustrated about all
No, I won't
the
get frustrated. I can
details.
do it. I can pull it. It's no big deal. I can do it.
All right.
You know.
And just talk to him and see, you know, if he'll talk to you. See if he's having a good day, and you'll get, you know, you'll understand a little bit about what your dad would want.
Maybe he can tell you why he won't let the nurses use the suction, or why he's trying to pull the feeding tube out.
Yeah. And you can also ask him, hey, the doctors think you're sick and you're dying, what do you want us to do? Want us to keep plugging away, or do you want us to let you go comfortably? See what he says?
I'll probably say, let's stay in the car, let's go.
What would that mean to you if he said that? Would it mean he's ready to let go and die, or would you think that he's just frustrated?
He probably would, I'm not sure. He's probably frustrated because you're sticking a tube down his mouth and he can't see you.
Yeah.
And his hands are tied up, probably in flashbacks back to World War II.
I guess it's important that he understands that even though he says, I want to go home, the truth is at this point he can't. It's not like this. So decisions would have to be made how to care for him. He doesn't really have that option right now to just go home.
Yeah, correct.
He's too sick.
I kind of want to paint a little picture of the future for you, just so you know what you're probably dealing with. This is educated guesses, so it's not facts. I can't, you know, I can't predict the future, but I want to give you kind of a feeling for what I think his future is going to look like. I think that at some point in the near future, they'll probably transfer him to a nursing facility. I think he'll probably stay there for many weeks, getting IV antibiotics, and they'll try to do physical therapy and try to feed him. I think during that time, he's probably going to get sick in some way and probably have to come back to the hospital. A lot of patients like this who are in bed, they get pneumonia, urine infections, all kinds of things, blood clots. Being in bed is a risk factor. Most people only survive about a year if they're bedridden forever.
And that's why you have those bubble things, the air brasses.
Yeah, exactly. Being in bed,
No pressure sores, right?
yeah, being in bed is a scary thing. People die from just being in bed all the time. So it's likely that during
The ulcers, that's what you say, right?
and bed sores too.
Is that the same thing?
Yeah.
Pressure sores and bed sores?
Pressure sores and bed sores. So, and they'll be working on that bed sore during that time. And my guess is over many months, he's going to get more and more short of breath, and that he'll probably pass away from it. And I'm not saying months to a year, so that would be my educated guess. Don't forget, it's more likely that I'm going to be wrong than right. But I'm just throwing out guesses based on what I've seen in the past. So the question is, does he want to live through that or not? And that's a decision that I think we should make every day. Just think, okay, how is it today? Does he want to live through this? How is it today? Do we want to live through this? Every day I think we ought to be thinking about it. Now some patients, some family members like you say right away in this situation, you know what, I know, he wouldn't want to live this way. It's ridiculous. Get him out of here. Let's send him home. Put him on hospice. Make him comfortable. And some families aren't that way, and some patients aren't that way. And if you see, all I'm talking about is trying to figure out what he would want for himself. That's how much
If he didn't want to live anymore, he would just say, please shoot me or something, I would guess.
Not necessarily. He has to be with it to be able to say that. He has to be completely mentally there to be able to give an answer to that.
I mean, that's what he told the Russians when he got caught, you know. But, you know, they told him, well, you're not getting out that easy.
This is a different circumstance, and it's hard to compare those.
Well, I'm just trying to tell you what kind of mentality you're up against.
Yeah.
Like with my dad a long time ago, with Kaiser, if he had a doctor that had a Jewish last name, he thought, oh no, we had to change doctors real quick because he was paranoid that they wouldn't treat him fairly.
Okay.
You know, that's the kind of mentality he has.
Okay.
Well, he's been through a lot. I mean,
Well,
You know, like as a kid growing up, me and my sister, we all beat my dad. We couldn't eat no French fries. We had grease on it. You know, Dad was very strict, and that's what led to my parents' divorce.
I would try to get, when somebody's dying in the family, I think it's important to talk to everybody in the family. I would try to make contact with your sister, get her involved in the decision making. I think it'll help you. It's good to have everybody's opinion about this so you can come to logical decisions for your dad.
Do you want us to reach out to your sister?
No, I'll do myself. I don't want you to do that.
You can give her our phone numbers or the doctor here, and they'll be able to talk to her directly and give her facts.
I just thought maybe you could print me out like a short, you know, like this right here. You know, it gives you all this stuff, like just one paper.
Ask Dr. Hodis. Ask Dr. Hodis.
I mean, that's not too bad.
Print out, so that there isn't really such a thing. So maybe she.
I mean, you get a daily log sheet, don't you, on your patients?
There's like thousands of little daily logs. There's like a logbook for every single thing they do.
Talking to their face.
Yeah. So you'd have to talk to Dr. Hodis about what she wants.
those are probably summaries you got from doctor appointments.
Yeah.
right?
No, this
No,
is,
those were the
this
hospital ones.
is, I guess this is
Yeah,
discharge.
they gave him the hospital.
This
Discharge
is,
instructions.
this is discharge of somebody with transfer orders,
Yeah.
written by, Andrea, I can't pronounce her name, she's a KP, I guess, named a doctor.
Yeah, it'd be best to get straight from the doctor.
This lady right here, I don't know if she still works here or not.
When is that from?
11/13.
So you don't think he's ready to let go? You don't think if he knew
I mean,
time, he'd say, leave
Then,
him alone?
you know, when I see him last night, it was, you know,
Well, I urge you to talk to him more, and we'll keep doing whatever you guys think is appropriate.
Eventually some things will become medical decisions.
well, I know.
If things don't work, then they won't try to keep doing them.
So let me ask you a question. Since you're a professional in medical field, what does this mean, advanced therapeutics? Well, my sister, I mean, if you look at this, if you look at, if you guys look at that, that's right. Just if you read that, you know, I went to their website and they got like 7 hospitals in the area there.
I don't really know. It looks like she's part of a big hospital organization.
Like a medical doctor or
No,
research?
it looks like she's a research
She's a
doctor,
researcher.
PhD.
I mean, she wrote some
Which a
pieces
lot of
on
people
infant hearts and stuff and
Right.
ovarian cancer stuff and
Yeah.
written a couple of books.
Yeah.
I'm just wondering, because I mean,
She'd probably be someone who'd want to talk to the doctors directly about it. Did you lost contact with your dad?
what's that? No, they haven't talked for like over 10 years. And I, you know, like this right here, with that kind of resume, would you hire somebody like that?
Not here.
Not here, I mean, but is that free? Is that take a lot of schooling to get that far?
Sure.
Or is it
PhD
not
is
really?
a big deal.
Well, it's more than a PhD on there.
She's a master's in business administration. I know it's a CC. I see.
She does
But she's a
research
clinical researcher.
in gynecology and gynecologic cancers. Yeah, that's
I mean,
pretty. She'll be able to understand all this stuff, I guess, is the best way to put it.
She'd be able to help you.
Yeah, she'll be able to.
you know, I was wondering.
Okay. Well, very good. Thank you for talking to us.
All right.
Yeah, we're available to you anytime you want to talk to us. We're kind of, I think we would be useful to you, actually, because we're kind of like a second opinion.
Second opinion for the doctor, or just for what's ensuring what's going on ethical-wise, I guess you call it, right?
Oh, yeah.
Can I ask another question?
Yeah.
Off track, but it says he's Catholic. Is that important to him? Did your dad participate in his faith at all? Or?
Yeah, he always went to church, and he always had a
Yeah.
cross on the door. You know, he's religious, you know.
Okay.
You know, he always made sure you were paying attention in church when we were little kids and
He
stuff.
can't have communion right now, but they'll be here tomorrow and they'll pray with him from the church, the Catholic church. They come on Fridays and Sundays. So that's something you think he'd want?
Yeah. Just,
Okay.
Are you?
Me?
He raised you Catholic, but do you?
Yeah, I mean, I don't go to church at all. I mean, I'm not an atheist, so, you know, I believe in God and stuff, but, you know, I go to church all the time.
Yeah, I was thinking if you had a priest, that it might help give you someone to talk to.
No.
Have you talked to anybody about what you've been going through with your dad being sick? Anybody?
I mean, I talked to a couple other people, you know, that there's, you know, there's one girl I know, she does home health care, and she was asking some of her clients, and they just said, yeah, well, Kaiser just wants them out of there so they can have their patient in there. They just, you know, it's a big conglomerate, they want to make money. You know, they just, but I know it's a stereotype answer, but that's what they said.
No, we're really trying to focus on what your dad would want. Give him the best care we can that matches what he would want.
Yeah. I'm just going to get, like you said, you just going to deal with things just to see what's going on.
That'd be great.
Yeah, so give yourself some time and then just let us know. We can follow up with you.
So are you a medical doctor too, sir?
Yes.
I thought you were like a psychiatrist
No.
or something.
No. I'm a medical doctor. I do this kind of care in the hospital.
And how many people do you come across like me that are, you know, in situations like this?
A lot.
A lot.
Yeah. I'm part of this team that talks to families, and so we usually deal with some more complicated cases too. So we deal with this a lot.
Why do you ask?
Oh, I was just wondering because, you know, there's 4 of you in here, And I'm sure,
Oh,
We
you said
represent
a different department, right?
different part of the
Yeah.
team.
The Kaiser entity.
Yeah.
So we,
And you're like
we're
the
team.
supervisor of the registered nurses on the staff here?
No, I'm a palliative care nurse. This is what I do.
Okay.
I help families
A
that
palliative
have
care.
palliative care nurse. I
So you're
help,
not medically helping people, just helping verbally talking to them and stuff? Is that what you're saying?
right, I don't actually do a lot of hands-on. I work with patients that are transitioning to hospice or to palliative care.
And
that
hospice means where someone's going to die
and the life issues.
and a lot of issues.
Or a patient that has a very serious illness, like a problem with their heart, and they have to have special medicines, and they're tired of coming back to the hospital, and they just want to stay at home. And they're tired of people bugging them all the time, and they want to be at home, and they want the nurse to come to their house. And so I help arrange those kinds of things and help their family understand what their wishes are. Because a lot of times families want to keep doing everything, and the patient's like, stop it. I just want to be comfortable in my house. Let me take my medicine. Show me how to take my medicine so I can stay at home. And then there's patients that are young, that have really bad cancer, like the ones your sister takes care of, and they're tired of doing the cancer treatment. They're tired, and they just want to be at home with their family, be comfortable, and enjoy which life they have and not be in the hospital anymore. So I help talk with families, because it's not easy to talk to people about this. I know this is very hard for you, and I'm sorry you have to deal with this all by yourself. And we are not trying to push your dad out of the hospital. We want your dad to be treated with respect and dignity. And him being tied down with a tube down his throat may not be the wishes he wants. So what I do is I talk to families, and we work as a team. And
You know, I know you have good intentions, but... You know.
no, I know you do. I know you love your dad. And this is not easy. Well, that's why we do what we do. We sit down and we talk with families, and we try and find out what they're thinking, what that patient would want. You're telling me he was a prisoner of war. He probably would never want anything down his throat and be tied down.
You know, a lot of bad things happen in World War II from the Russian side.
He might have been willing to put up with some of it if there was a...
If he knew he was going to get better.
Right, if he was going to be cured and walk out of here and go back to his life. The thing we're facing now, though, is that's not going to happen.
So it's best to tell me there's no hope for you, you're going to die pretty soon.
Unfortunately, all of us face the end. It's not that we're
that-
hoping for
It's not
that.
we're giving up on him,
Yeah.
it's that we're trying to make sure he goes out peacefully, that he
Prepared
goes
for the
out.
worst.
Transition so he could be
I
comfortable.
mean, my dad was always prepared for the worst. When he used to go to Germany and travel on airliners, he used to take out life insurance in case the airplane crashed.
Mm-hmm.
Every time.
That's very smart.
Every time. Made sure he had car insurance, everything. Everything was covered. So if anything happened, everything would be okay.
Right.
He didn't want to end up in a county hospital in LA somewhere. That's why he chose to have Kaiser.
Yeah. That's a good choice. It's a good choice. Kaiser's a good company, and that's why you're being offered all these different options. Fortunately now, as adult children, of our good parents have to kind of end up being their voice. And you're in that situation now, having to kind of be his voice. He can't really tell us, so, although maybe he can in German, I don't know.
And because of the way the world is these days, the person who's that voice, the main thing they need to do is learn when to say enough is enough. Because the medical system will keep beating on a patient until somebody says enough is enough. And that's why I think I wanted to concentrate on making you understand what's going on here, make it really clear that we thought he wasn't going to do well in the long run, so that you can make wise decisions for him. So
I mean, according to the scouting, it's all he's going to be around for a couple more days, and that's going to be it, or a week. I don't know. First it was a couple of days, he said a week, and then he didn't know.
He was really sick. And I was surprised when I saw him this week, and he looked so much better.
And he's likely to have more
But
problems.
he's still going to keep going
Right.
like this.
His course is going to be up and down. Looks good, looks bad, looks good, looks bad, looks good, looks bad. And I think it's going to get worse and worse with time.
So it's really a question of how much he wants to put up with.
Right.
You know, when my dad was healthier, he used to get up at 6 in the morning, go to bed at 9 o'clock, eat his oatmeal, go play tennis.
Yep.
outlet dollars friends from work. And,
Wow.
you know.
Something allows him to survive the snow with no boots,
Mhm.
you know, when,
And then, you know, they asked me when I brought him lunch to him, he goes, well, what happened to his toes? Oh, that's part of the diabetes. I go, no, it's not. That's been like that since
Frostbite.
1944,
Mhm.
from frostbite. I mean, I thought you could tell the way it was stitched, you know, it was tenderly put together. But I've seen his toes, there's no more big blisters on them like when he had before. No more those big bubbles they had.
I haven't seen.
Well, we'll let you get back to him.
Yeah, we've given you a lot to think about.
Okay.
Thank you for coming and meeting with us.
Oh, it wasn't I'm just sorry that the traffic was bad and I got off work a little bit late.
That's all right.
He's driving from Cerritos.
Yeah.
I'm going to say something that may be a little hard for you to believe. Most of the people that walk into your dad's room have his best interest at heart, and not the system's best interest, not Kaiser's best interest, they have his best interest at heart. And I think the more contact you have with the people here and wherever he ends up, I think the more you're going to find that. I can speak for the doctors. 95% of what's going on in their brain is what's good for this patient. And if they ever challenge you on something, usually it's because they think that we need to be doing something that's better for him.
Well, you know, like one time I came here at 1 o'clock in the morning, and I was standing with my dad. I was well dressed, and the nurse came and she says, "Oh, what department do you work in? I haven't seen you here before." And I don't work here. I mean, that's my dad right there.
Okay.
You know, and I asked her, "Have you been cured yet?" And she goes, "No." I got thought that thing says right there every 2 hours. You know, then I'm going to ask her some questions, and then she wasn't there, and so the other nurse had to fill me in. So, I mean, it's no big deal.
They're perfect.
I know. I'm not saying
I'm
that.
just saying that everybody's going to be well-intentioned overall, and that I think you better remember that. Because it sounds like you worry that everybody has motivations that aren't the right for your dad, and usually they don't. Usually they're just trying to take care of.
It's good she asked you who you were. There shouldn't be strangers in here at 1 o'clock in the morning. And usually in the intensive
you know,
care,
when you go to the Torrance Hospital, you can't even get past the front door out there. They'll ask you, "Where are you going? What are you doing? Who are you here to see? What's your ID?" Here it's kind of different from Torrance, I guess. You can go right up to the ICU, you know, your intensive care, and hit the doorbell and let you right in.
Right.
No questions asked.
So my advice to you, stay involved, try to hang around the hospital a little bit, talk to the doctors most every day, and get an update. I really would, because I think that's going to be important for you to help make decisions.
you might tell the doctor what time, like if you get a lunch break, what time you think you call you, or that you call them back so that you do have that
I
opportunity.
mean, when they
to
call
talk
me
to
before, I always call back the 644-2000 number, and I ask for my dad, you know.
Yeah.
And then they ask for they put me in my dad's room, and I go, "What are you doing?" He can't talk. And then I ask the nurse's station, and they say, "Oh, he's doing fine, everything's okay, it's okay."
You can ask the nurse to page the doctor and have the doctor call you.
Yeah, if you call, ask the operator.
And why is it so complex like that? I don't
Well,
understand.
call and ask the operator to get you the nurse for your father.
Okay.
Yeah. The problem is the doctors are moving around all the time, and
They're not always in one
they're not always in
spot.
one spot, so.
I
They
got
have
it.
those pagers.
Take care of patients.
Yeah, all over the
Everywhere,
hospital.
on all floors.
Yeah, so they're not.
So I guess you guys are understaffed, the doctors, or
No.
that's the way the
No,
hospital's
that's just
staffed?
how they assign them. They follow people, not rooms. So
Okay. So it's not like, you know, right, why go to different pump stations all the time, and stuff like that.
What do you do for the city of Cerritos?
Wastewater,
Oh,
What do you mean?
wastewater.
Okay.
you make sure all the pumps are on.
Okay, great.
So,
That's a very important job, thank you.
I mean,
don't live in Cerritos, but.
it's all on that, you know, their shift takes over, and something happens, they just page you or whatever.
Mhm.
It's all on computers, you know, it's like with patients.
So do you wear a pager at your work?
Yeah,
So same kind of thing. So if you're out working on a machine and they page you, that's
yeah.
somebody's trying to find
And they
you
don't want
because
they don't
know
want
where
that
you are.
sewage going in the street. They have to write a big essay to the State Water Resources Control Board. What happened? Why the pump failed?
Oh.
And was it a mechanical problem? Was it a human error problem? You know, it's a big deal. I get the same thing with medical things too. You know, the patient dies and what happened or whatever. You know, you have all kinds of regulatory agencies too, right?
Money.
So mostly we're accountable to you guys, to the family, and
Yeah.
to the patient, making sure that, like Doctor said, we do what you want and what he wants,
Yeah.
and what's best for him. That's our goal.
Well, thank you for meeting with us.
Okay.
Appreciate it very much. I'm not going to shake your hand today.
That's right. It's okay.
Don't want to get in.
So that's your business there, right?
Definitely Friday, yeah.
All right. So I can call you or have my other family member call you. It's not a problem, right?
Yeah, if your sister would like to talk to someone, we're happy to talk to her too.
I think it'd be a good idea.
Yeah,
Get everybody in the pool.
yeah, the cell phone number on there is the best way to reach.
Okay, all right.
All right, you
Okay,
take care,
all right,
Ralph.
thank you very much
Take
for
care.
meeting with me. Sorry if I held you up, so I was late.
Oh, no, don't
I
worry
know
about
you
it.
got other, you
We're
got
glad
other
you made it.
appointments.
We're glad you made it.